So we had botulism. Botulism is a neurotoxin, and it paralyzes the neurons in your muscles, and it restricts your muscles from contracting. It's caused by an anaerobic bacteria. There are 110 cases yearly in the United States. 25% of them are from canned foods, and 75% are infant cases. It can be caused by improperly canned foods or in infants if they ingest a toxin. Some signs and symptoms. It becomes more difficult with time to speak and swallow. Your mouth becomes increasingly dry. Your face muscles weaken over time. Your vision worsens. Paralysis starts to set in along with cramps, nausea, and vomiting. Often sets in about 12 to 36 hours after ingestion. The treatment is an antitoxin injection, which will help with your muscles, and then you can also have breathing assistance because of respiratory failure.
So we have rhabdomyolysis, and what it is a breakdown of muscle fibers. It causes a release of myoglobin into the bloodstream. So what it's caused by, it's triggered by muscle injury. It can be by physical means or chemical means, so like toxins or drugs. The signs and symptoms are dark urine, muscle weakness, fatigue, muscle tender to the touch, fever, vomiting, nausea, confusion, or even weight gain. The treatments are fluid recovery, so like an IV, medication, bicarbonate specifically, and dialysis. And then the next one is tetanus. So what it is a bacterial infection caused by a puncture that affects the nerves or the muscles. And it is a bacteria called Clostridium tetani, found in soil, dust, and animal feces. And it goes from the animal feces, which makes a tent, and then it goes into the muscle neuron. The signs and symptoms are spasms and stiffness in jaw and neck muscles, difficulty swallowing, fever, sweating, and rapid heart rate. The treatments are antibiotics, see a specialist, consult a doctor for medical advice, or get a tetanus booster if you haven't in the last 5 years.
Alright, we have a sprain, and it's simply defined as a stretching or tearing of a ligament. Owie. The causes of a sprain are when you're walking or exercising on an uneven surface, pivoting during an athletic activity, or landing on an outstretched hand while falling. Zoinks. Now the silly signs and symptoms of a sprain. Now that's a tongue twister. They are pain, swelling, bruising, and not being able to move the joint. Wow, that would be quite disabling. Now for the treatment. We have this clever acronym that stands for rest, ice, compression, and elevation. Some people are just so intelligent. Strains are also known as a pulled muscle. Ouch, just terrible to even think about. How do you acquire a strain? All you need to do is stretch your muscle or lift a heavy object the wrong way. If you're experiencing pain, swelling, or muscle spasms, you may have a strain. Uh-oh. On the bright side, strains are most often self-treated, which means you can go back to that pesky acronym, RICE, and apply those to your injury. Tendinitis is the inflammation or irritation of a tendon. Ouch! The cause of tendinitis is repetitive minor impact on the affected area. Swelling and pain is the most obvious signs and symptoms. It may also be warm to the touch. To treat this injury, all you need is ice, rest, and if it's bad enough, maybe therapy.
Torticollis, a condition in which the head becomes persistently turned to one side, often associated with painful muscle spasms. And causes, no one knows for sure, and caused by an abnormal fetus position in the uterus, and it affects the sternocleidomastoid. Signs and symptoms are head turned to one side, unwilling to turn head to one side, shoulder pain, back pain, headache, neck cramps, muscle tightness, or burning sensations. Treatments are medication, physical devices, physical therapy, stretching, exercises, and surgery. Muscular atrophy. Muscles start to waste away due to the lack of physical activity. The causes are normal aging, burns, malnutrition, any other muscle disease, not moving, osteoarthritis, polio, and more. Signs and symptoms are dizziness or lightheadedness, dangerously high blood pressure, one arm or leg is smaller, weakness in a limb. And the treatments are exercise, physical therapy, ultrasound therapy, surgery, and dietary changes.
Fibromyalgia is characterized by the widespread of pain of muscles and soft tissues. The exact cause of fibromyalgia is unknown, but it's believed to be genetic. Signs and symptoms include severe headache, chronic muscle pain, spasm or tightness, fatigue, insomnia, difficulty concentrating or remembering, or numbness and tingling. There is no cure known, but many medications or physical therapy can be used to minimize pain. Trichinosis is caused by eating infected meats. So it's caused by eating meats that contain cysts with larvae or immature worms that have not been thoroughly cooked. It can be found in pork, bear, fox, rat, horse, or lion meats. Signs and symptoms include abdominal discomfort, cramping, nausea, vomiting, or diarrhea, facial swelling, especially around the eyes, fever, muscle pain, or weakness. It's treated with pain-easing medications.
Muscle disorders. Muscular dystrophy. It's caused by something in genetics. Signs and symptoms include pain in the muscle, abnormal walking, muscle weakness, flaccid muscles, fatigue, shallow breathing, and delayed development. Treatments. There's no known cure, but you can take medication, have surgery to maintain function, exercise, or use a splint. Myasthenia gravis. It's a breakdown between communication in the nerves and muscles, causes weakness and loss of muscle control. Signs and symptoms are weakness in the arm and leg muscles, double vision, and difficulty with speech and chewing. There's no known cure, but there are some treatments like physical therapy or taking medications to help with it. Finn.